Okay, so we're going to get started. We're going to do the lips first. I like to break up the lips into quadrants just so I can keep things straight. So I'll inject one half of the upper lip and then go inject the other half of the upper lip, and then come and inject one half of the lower lip and then do the other half of the lower lip, just so I keep things straight. So we'll start off with the upper lip. You doing okay?
Mm-hmm.
And so with the local anesthesia, it's usually pretty painless. There may be some areas that aren't completely numb. So I usually put the needle right at the junction of the lip and skin border, or the red skin border. And we'll do some fillers into each of that area and kind of keep moving along. As well as you can go a little bit into the body of the lip as well. What you don't want to do is you don't want to get the product that's down below what we call the wet, dry border, or the portion of the lip that's wet, because then it'll make the lip look like it's hanging. So let me come to the other side and do the same. Here we are on the other side, and basically I just try to mirror what I did on the right side. And we'll do the central portion of the lip. So now I'm to the other side. So, as in to keep with the patient's wishes, we'll stop there for the upper lip. And so it's a conservative amount. We've done about 0.3 cc's into the upper lip, and I'll do maybe about that or a little bit less on the lower lip. I like to work in quadrants, and that way it helps me keep it straight so that I don't inject too much in any one area or too little in one area. So we're almost done with the lower. Okay, so again, in keeping with the patient's request of just having a very modest increase in size, we'll stop there. Part of it, the lips are bigger, but part of it is because of the swelling, just because of the placing the needle back and forth. And of course, a lot of that is the product itself. So now I'm going to change gears, and we are going to go to the laugh lines. So that area has also already been numbed. So it's the same sort of technique or principle. It's a threading type of emotion. There's never any one giant glob of it put in or mass of it. It's small amounts being placed at each pass, so that decreases the chances of having nodules or problems. And it's somewhat moldable once it's in. You'll see me with my finger kind of mashing down and pressing. You can't move it from one area to another, but you can bring down a high point with your finger if there's one that exists. Okay, so that's about, okay, so the right side is done. We'll go to the left side. Same sort of technique and motion. So I always leave a little bit for the end and kind of look things over and make sure that I feel that everything is straight. So if there's any one area that I have left out, then I can use that little last bit for those areas. But everything looks for the most part good. So I'm going to finish up here. Okay, so we're all done. So that was the treatment. That's a typical treatment. Was that painful? No. So with the local, it really does make it pretty tolerable here in the office. So that's the treatment. Again, we used Juvederm, and we did upper and lower lip and laugh lines. Dr. Mark Jabor, Cosmetic Surgery and Laser Center of El Paso.